Imagine that one of your friends or family members is in a hospital bed about to die of lung cancer caused by secondhand smoke that you created. Would you blame yourself for their death and wish that you could have quit sooner? According to the World Health Organization, there are an estimated 1.3 billion smokers worldwide, but this amount will grow to 1.7 billion before 2020. Almost everyone in my family has been a smoker. My father and mother always smoked cigarettes when I was growing up, so I've been around cigarettes my whole life. I have also seen loved ones die of lung cancer and stomach cancer due to smoking cigarettes. I have smoked cigarettes for around 3 years and tried to quit many times. I recently kicked my habit and continue to live a cigarette-free life. Since I used to be a smoker and have seen the effects of smoking, I thought it was very important to talk about this problem. Cigarette smoking is a major issue that affects your health and the people around you. I would like to discuss why smoking cigarettes is harmful, what you need to do, and the benefits of quitting. Yearly, Americans are killed more by tobacco use than cocaine, heroin, crack, alcohol, car accidents, fires, AIDS, homicides, and suicides combined. According to Mary Cooper, who wrote Tobacco Industry, tobacco smoke contains more than 4,000 chemicals. Many of these chemicals are toxic and cause cancer. As you can see from this model, that there are many ingredients in cigarettes that can also be found in deadly items. A few chemicals that are in cigarettes are cadmium, butane, arsenic, methanol, and ammonia. These chemicals can be found in batteries, lighter fluid, poison, rocket fuel, and toilet cleaners. I doubt anyone would want to consume batteries or toilet cleaners, so why inhale these chemicals from cigarettes? The chemicals in cigarettes can increase an individual's risk of having stroke, emphysema, heart disease, and respiratory disease. Smoking is also linked to many cancers, such as cancer of the stomach, cervix, bladder, lung, and other types of cancers. As you can see from this comparison, that these are two lungs. To the left is a healthy lung that belonged to someone who didn't smoke. To the right is a black and disgusting lung that belonged to a smoker. The smoker's lung is black because of the tar and cigarettes that the smoker is inhaling. When a person smokes, they aren't just putting their life in danger, but they are also putting others in danger as well. Non-smokers endure harmful health effects from secondhand smoke or environmental tobacco smoke, which is created by the person who is smoking. According to a 2006 report by the Surgeon General, secondhand smoke causes 3,400 lung cancer deaths and 46,000 heart disease deaths in adults, non-smokers in the United States every year. A lot of people believe that smokeless tobacco is healthier than cigarettes. However, chewing tobacco is connected to many health problems, such as tumors in the nasal cavities, cheeks, gums, and throat. In fact, people who chew tobacco have a greater risk of developing mouth and throat cancer compared to people who smoke cigarettes. In addition, chewing tobacco damages the gum, tooth surfaces, and jaw bones, which increases the chance of losing teeth. Cigarettes contain deadly chemicals that affect you and the people around you. But it isn't too late to quit. There are many methods that are used to quit smoking cigarettes. Quitting completely, also known as cold turkey, is the most common method that is used. This technique might involve many efforts if it is spontaneous. However, if a person prepares, then their chance of quitting will increase. Another method that is used to stop smoking is nicotine replacement therapy. A person could buy nicotine patches, inhalers, gum and nasal spray, and prescription pills. These products contain small doses of nicotine which decrease cravings and withdrawal symptoms. The prescription pills also make smoking less enjoyable and nauseating. The most effective way to quit smoking is using the cutting down method. In this method, a person may decrease the amount of cigarettes each week. For example, if you usually smoke 6 cigarettes a day, only smoke 5 a day for the whole week. Then the next week, you can cut down to 4 a day. Eventually, you will be smoking fewer and fewer cigarettes. It is also best that you pick a date to completely stop smoking. However, this date should be within a short period of time. When you quit smoking, you will see improvements not just in your health, but in your wallet and appearance as well. There are short-term benefits when you quit smoking. The moment you put out a cigarette, your heart rate and blood pressure will return to normal. After a few hours, the level of carbon monoxide decreases, which will allow your blood to carry more oxygen. You will also see improvements within a couple weeks because your circulation progresses, you create less phlegm, and you will cough less. In addition, your cardiac function improves, which will allow you to do normal activities that won't leave you out of breath. When you quit smoking, you will see more. After you quit smoking for a long period of time, you will continue to see more improvements in your health. After many months of stopping smoking, your lung function will improve, and after a year, your risk of having a stroke and heart disease greatly declines. If you continue to quit for 5 years, your risk of developing cancer of the stomach, cervix, bladder, and lung greatly decreases as well. Eventually, around 10 to 15 years, the risk of developing respiratory disease like bronchitis and emphysema are decreased as well. When you quit smoking, you will see more money in your wallet. I know firsthand that buying cigarettes can be expensive. For example, I smoked a pack a week and spent at least $5. But then I found out I was spending $25 a month. I then discovered I was spending $300 on cigarettes a year. However, I have been smoking cigarettes for around 3 years, and within this period, I have spent over $1,000 on cigarettes. However, people who smoke a pack a day spend around $2,000 on cigarettes a year. Now calculate, how much do you spend on cigarettes, and the amount might surprise you. There are other financial benefits such as paying less for medical bills and life insurance. I know I would rather spend my money on something else. When you quit smoking, you will see improvements in your appearance. You will have better oral health because your breath will smell better and your stained teeth will become whiter. Let's be honest, no one wants to kiss someone with nasty teeth because it's disgusting. Your clothes and hair will smell better too because you won't smell like smoke anymore. Also, the yellow tint in your fingernails and face will go away. In addition, your risk of developing wrinkles or gray hair will decrease. Basically, you will look younger and you won't look twice your age. I think we can agree that improvements in our health, wallet, and appearance are worth quitting. I believe smoking cigarettes is an issue that affects everyone and it is vital that you stop. In this speech, I have proven why smoking cigarettes is a major issue that affects your health and the people around you. The chemicals in cigarettes cause cancer and health complications among smokers and the people around the smoker. I have discussed the cold turkey technique, nicotine replacement therapy, and the cutting down method as ways to quit smoking. In addition, I have talked about the health, financial, and cosmetic benefits of quitting. I'm just asking you to quit smoking. This will allow you and the people around you to live a healthy life. I decided to quit smoking because it affected my health and my loved ones. Ask yourself, do you want to cause negative health effects to you and the people around you? Do you want to be responsible for the death of a loved one? Just remember that when you smoke a cigarette, you are causing people to die. All you have to do is put the cigarette down and make the right choice.